what's the key things that you've learned then over this last year about what your role's all about, especially in relation to people on disorder of consciousness?
Yeah, I think I've kind of realised since starting the job that my role is very different to what I thought it was going to be. Yeah, the title speech and language technician, I feel like I do a lot more that isn't actually speech and language therapy, particularly with the PDOC patients. And that's one of the things that really struck me when I first started and met that first PDOC patient, was how on earth can you do speech and language therapy with this patient, because they can't talk, you know, it's just not going to work. And I think, yeah, over time I've realised that there's a lot more to the role than that. So yeah, particularly with PDOC patients, it's a lot of kind of observations and monitoring and looking at behaviour and things like that, rather than sitting down with a pen and paper and doing speech and language therapy. So yeah, I've realised that a lot over the year, how different it is to what I maybe imagined, and what I think kind of my friends and family think I do is very different to what I actually do on a daily basis, definitely.
Does your role include any kind of taking part in tasters, or is that always left to the speech and language therapist?
So with the SMART assessment and things, yeah, no, so sometimes I'll join in with the SMART assessments, more probably for my own learning, because I'm still quite new to it, just to kind of observe, or maybe help out by taking notes whilst the therapist actually conducts the assessment. So rather than them multitasking, I'm there scribbling away and ticking boxes, and they're actually doing the assessments. And then a lot of what I do is probably outside of the actual formal SMART assessments, things like the WIM, the Wessex Head Injury Matrix, to kind of just monitor behaviours and monitor awareness over long periods of time, to see if there's kind of any patterns of behaviour that are quite consistent, or whether there's anything that might be meaningful in there. And also doing the extended assessment. So once the therapists have done the SMART assessment, they'll pick out a lot of the patient's strengths and put that into a bit of an extended assessment, which I then work with. So things like their tracking or eye contact, or kind of their responses to different stimuli, whether it's auditory or tactile. Yeah, so I'll do that kind of supporting work, I think, to go kind of with the SMART, to complement what they find in their sort of formal sessions. Yeah, that's my role.
Fantastic.